Hi everyone, welcome to this CF Live event focused on experiences and outcomes in adult CF care from both our patient experience survey and the UK CF Registry. If you're not on the panel for today, can I just ask everyone to ensure their mics are on mute and cameras turned off now, please? Thank you for that. So my name is Jana and I'm the Clinical Quality Improvement Manager at Cystic Fibrosis Trust. And I'm joined today by two of my colleagues at the Trust, as well as three members of our Quality Improvement Working Group and Involvement Network. So we'll start with a round of introductions, I think. So can I ask my colleagues, Sophie and Yumi, to please introduce themselves?
Yep. Hi, everyone. I'm Sophie Lewis. I work in the Quality Improvement Department in the CF Trust, and I'm also an adult with CF that attends Exeter Hospital.
Hi, everyone. Yeah, so my name's Yumi. I'm one of the medical statisticians, and I work in the registry team at the Trust.
Fabulous. Thank you. And as I said, we are joined tonight by several members of our Quality Improvement Working Group and Involvement Network. So could I now please ask Laura, Charlotte, and then Martin to introduce themselves, please?
Hi everyone, my name's Laura Beattie and I'm an adult with CF2. I attend Manchester Adult Cystic Fibrosis Centre just in Wythenshawe, and like Jana said, I'm involved with the CF Trust Quality Improvement Working Group.
Hello, I'm Charlotte Bones, and again, I have cystic fibrosis. I attend the Royal Brompton Hospital in London, and again, as Jana said, I'm part of the working group, and very much enjoy it.
Hello, I'm Martin Rolfe. I'm a patient with cystic fibrosis. I also attend the Royal Brompton Hospital. And I've just kind of come onto this working group just to have a look at this survey in the first instance.
Fabulous. Well, thank you, everyone. So we have a packed program for you tonight, as you can see, with the number of speakers we've got lined up. We'll start with the presentations first. There are two presentations, and then we'll have time for questions at the end, I expect. But as questions come up, please feel free to type them in the chat. Colleagues of ours are there monitoring the chat, and we'll do our best to kind of get back to you on all the questions posted down in the chat throughout the event. So we'll start off with an overview of some of the kind of key insights and recommendations from our patient experience survey in adult CF care, which we did in 2023 and early 2024. So I will hand over to Sophie initially, and then several of our other speakers. So go, Sophie.
Okay, so let's get started with our patient feedback and recommendations. So one of our key projects in our team is to do a survey on patient experiences in adult CF care. This is repeated every 3 years. So I'm sure many of you will be familiar with this. This is our second iteration of the survey for adults. Now, it is voluntary, so CF services are invited and choose to take part. And we did have a fabulous amount. We had 25 of the 28 adult centres participate. And we gathered a huge amount of responses, and it was 1,250 responses, which represented over 20%. So if any of you did respond to the survey, thank you very much. The data that you provide is invaluable and helps us and your local team. I'm going to hand over now to Laura to chat to us about access and support by profession.
Thank you, Sophie. I'll be discussing the access and the essential support provided by the Cystic Fibrosis MDT and how each team member plays a crucial role in delivering comprehensive specialised care to those living with CF. So the standards of care emphasise that MDT support is essential in CF management for both children and adults. This approach ensures patients can access a range of professionals, each bringing expertise suited to the unique challenges that CF presents. Professionals within the CF MDT include clinical specialists and consultants, clinical nurse specialists, physiotherapists, dietitians, clinical psychologists, social workers, and pharmacies. Together, these roles form a comprehensive approach to CF care, addressing not only medical needs, but also psychosocial and practical aspects of living with the CF. In a recent survey, patients who had access to these CF team services were asked to rate their satisfaction with each profession. The question was, if you have access members of the MDT, please rate your experience of support received. The response was overwhelmingly positive, with 96.3% of ratings across 7 professions falling into the excellent or good categories. This high satisfaction rating shows the level of support and expertise patients experience from their CF teams. Interestingly, this level of satisfaction held steady across various centres with only minor variations. The median satisfaction rating was 97%, ranging from 90% to as high as 98.9%, which highlights the quality and consistency of CF care across the different locations. And these findings are based on data from all participating CF centres, which was 25. Breaking down the satisfaction ratings by professions, patients rated support from doctors, nurses, physiotherapists, dietitians, and pharmacists particularly highly. Each received over 95% excellent or good ratings. Psychologists and social workers were rated slightly lower, though they still achieved over 90% positive ratings, underscoring that all members of the MDT are valued for their unique contributions. To bring these findings to life, here are a few quotes from patients. One patient shared, "Some members of the CF team go above and beyond to support me, especially the social worker, specialist nurses and dietitian. They help me to handle the pressures that CF puts on my life." Another patient emphasised the personal connection with their team, saying, "The nurses and physiotherapists are efficient and friendly. They get to know you well as a person with a life beyond CF. Social workers and psychologists are also great." And finally, "I received good, clear responses and directions from my consultants." These testimonials reflect how the CF MDT's coordinated approach not only manages the complex needs of CF patients, but also supports them in feeling understood and cared for as individuals. In conclusion, looking at this data, the CF MDT approach is essential for comprehensive patient-centred care. The high satisfaction rate demonstrates how each team member's dedicated role makes a meaningful impact in the lives of those with CF. And now over to Charlotte.
Thank you, Laura. So I'm going to be going through the patient-centeredness and support given. So yes, as you can see on your screens, we're very lucky that cystic fibrosis has come so far in the years, because the access to referrals has got better. So loads of patients were actually really positive in terms of, yes, we got our referrals, and admittedly, I will admit I'm probably one of them that they don't always communicate as well with each other as they possibly could. However, we're very lucky that things are in place for these referrals and for things to be picked up on a lot earlier than they ever used to be, such as diabetes. And that is obviously the key one. We will find more, I imagine, in terms of as people with CF get older, they will need referrals to other specialists. And if this continues to get done, I'm really hoping that this will get bigger in terms of there's going to be more things. Not that I want anything to be wrong with people, but in terms of that people are getting that care. And it's really positive that so many people responded and actually are having that access to the referrals they needed, especially from things like social work that isn't necessarily CF related, but it has a huge impact, because CF isn't just an illness, it affects your mental health as well, in terms of, for instance, the weather's really quite bleak out, if we're all quite frank. And I know the air was quite muggy, not muggy, but kind of bleak. And I felt I couldn't breathe quite right this morning. I was like, oh, and I know that we all need to keep on top of it, but it's a mental thing as well, in terms of we know we need to keep well. So we're going to focus on maybe a bit more physio, some more nebulizers. So having that all round health and that more holistic approach I think is really great. It just happens to be that 4 years ago today, I was actually taken off the transplant list for various reasons, which I won't bore you with this evening. But again, transplant is on this, and it's not the biggest number by any chance, by any matter, but it is on there. And all of those communications that you have with teams are really, really key. And I'm hoping that what we can take out of this is that teams will hopefully work more and more together and collaboratively. So for us people with CF, it's a lot easier, as well as actually for the hospitals, so they can all communicate, because sometimes you're not just under one hospital with them. You may need to various different hospitals if they don't have that speciality. So yeah, it's great to have these sort of surveys that we can understand and help build on for future. So I think that's me. So over to Martin.
Hi, so I'm going to talk about the annual review process and the stats that were found in the survey from those questions. I'm kind of really interested in this because it's one of the most time-consuming visits you have after an inpatient stay. So I'm kind of interested to see how other people were feeling about this. And my personal experience is that the annual review process actually changed quite a bit since COVID and over the last couple of years, especially sort of at Royal Brompton, where a visit is kind of crammed into an afternoon, where it used to be like 2 visits, and now it's kind of 1 visit and you see a doctor at the same time. And in the stats, you can see that most people get to see at least 4 of the team, the doctor, nurse, physiotherapist, dietitian, the 4 that you would expect, but less likely you're going to look at seeing a psychologist, social worker if your hospital has one, pharmacist, and other whoever they are. I think it's important really to look at these sort of things and think about. So some of the reasons they found that the psychologists weren't being there is because they're not actually in the hospital. And I think at annual review, it's kind of good to see, even just say just hello, so that it's not a shock if you ever need to use those services in the hospital. And so, yeah, I think it would be a good idea if that was kind of improved and more people were able to see a psychologist if they needed one. And mental health has kind of been highlighted in some of these reports as being a big issue with people with CF. I think that's all I had to say. So yeah, I'd like to hand over to Charlotte now, who's going to talk about something else.
Thank you, Martin. So I'm going to be talking very briefly about outpatient clinic experiences. I think this is really very interesting. So this survey was done in 2023 to 24. And obviously the outpatient experience will be very, very different in terms of there's a lot more remote monitoring now, which is absolutely great. And as Martin mentioned, the annual review process and sometimes going to clinic can be quite traumatic. It can make you kind of build yourself up to get anxious. It can also just be the time, the travel, etc. So having that remote access is really great. That remote monitoring, sorry. So what we have seen on here is how many people are taken to a private room, which I think is fairly standard for a lot of hospitals. However, just due to the sheer pressures and the volume of people, obviously, that clinics have, there is sometimes they are placed in a waiting room. So over time, hopefully that number does decrease, the waiting room, and more individual numbers. But that's obviously a bigger NHS issue. I think I was really pleased to know that when remote monitoring is clearly working, because the outpatient experience is very much good, I suppose. So I think it's can't fully see that screen, sorry. That you're taken to your own room. So hopefully the remote monitoring is also helping in terms of you can actually have that room. So people are coming in at different times, which is obviously really, really good. Sophie, is it possible just to go to the next slide, just for the... Please, thank you very much. So sorry, this was what I was kind of banging on about and it wasn't quite on the screen, so I do apologise if anyone got rather confused. So the standard things when you go into clinic, I think, would be lung function, height, and weight. And it's really good that they are taken as a measurement. And the amount of people that are obviously reporting that they are having them done is good. Still could do, I think, with room for improvement at times. A lot of people do them at home now. For instance, if I go to a clinic, I would do my lung function at home prior. And I would possibly do my weight. They will do it again, but just so I have an idea. And I've got my kind of full rounded information that I need. So yeah, I think it's really good that people have adapted well to remote monitoring. But obviously there is a slight issue, I think, that not everyone likes that, and that probably should be taken into consideration when doing clinics. And as Martin touched on upon with annual reviews, that as well, CF is not a one size fits all, unfortunately. So what some people like in it, other people don't in terms of their care. So I think we just need to bear that in mind with any kind of survey. There's always going to be a slight difference. But I think the response was huge, which was really, really great. I think 25 out of 28 centres took part, which is really good. And obviously the care and standard of care with people with cystic fibrosis has definitely increased over time. So that's a huge thing, and great for people with CF to know that care is hopefully ever growing and getting better. So I think that's now back to Sophie.
Thank you, Charlotte. So I'm looking at the recommendations, and we have touched on a few things from the report. However, it is vast and covers so much of the CF pathway, which we couldn't, as I'm sure you appreciate, go into all of it tonight. So please review the report, which a link will be put in the chat if not already on there. From the overall findings of the report, it was analysed and had additional input and advice from our CF community, which was Laura, Charlotte, Martin and Simon, who couldn't be with us tonight. And from this, we've come out with several things that need to be looked at, either by individual CF teams or on a larger scale. So let me go through where we are so far with the recommendations. So the equitable access to specialists with CF expertise, particularly social workers, clinical psychologists and pharmacists. Now, to tackle these issues, we as a QI team are working with several working groups that have been set up to improve our understanding of what is driving these gaps and variations in access. And we're doing this in collaboration with the relevant specialist groups, for instance, the CF social workers and psychologists, GI groups, so that's the gastroenterologists and bowel screening, the UK Cystic Fibrosis pharmacy group, and then we have a further one on diabetes group. So some of these issues were also highlighted in the paediatric survey, and so some of these groups are looking at both across the board. The enhanced person-centred approaches to CF care, considering people's individual needs and preferences, offering choice and involving patients in decisions, and improved communication, specifically timely feedback from tests and annual reviews. Now this is where this does come down to our CF teams. And just to note that all participating CF teams will have received both their anonymised report and this UK full report. And so they can see that their own insights of their own centre and hopefully look at what changes they could make to address some of them, because not all of them would have had the same issues as another centre would. So what we can do and what we can offer is the CF teams can benefit from our help as a QI team, where we can create a holistic report and we can work with them and look to see how improvements can be made specific to them as a centre. Now, for an example of this, and I know Martin went into detail about the annual review, Fiona and our team worked with Glasgow Paediatrics in a QI project to reduce the annual review time, specifically the review assessment to finalised report. And they managed to, as a team, with the help of us, reduce that from a 6 months to 8 weeks. So these are the sort of things that we want to help with and when the CF centres identify. So if you do identify a quality improvement project next time you're in clinic or in inpatient, please do encourage your CF teams to reach out to us. So greater collaboration and coordination within and beyond CF teams to support a growing and diversifying adult population with CF. And Charlotte highlighted people are living longer and we are more aware of these other things that come up with CF and understanding that impact. And the CF Trust is analysing the ageing population, and we will work together with our registry and policy colleagues also. However, more will need to be done to look at this in the future. And then lastly, one of our recommendations is equitable and high quality access to care in the community, including specialised medicines such as modulators and home IV antibiotic therapy. So working with our policy and public affairs team here at the CF Trust, they have ongoing work where we recently submitted evidence to the House of Lords inquiry into home care medicine services. And they are also feeding into the NHS key performance indicators on home care medicine service. They recently did a short survey to the patient involvement group to get the experiences of those and be able to give that and submit that to the NHS. And that piece of work will be given to them this month in November. However, again, further work will need to be done for this recommendation. So having highlighted the main areas of recommendations out of the survey, we recognise that lots of work still needs to be done behind the scenes. And rest assured, we are trying to tackle each one by getting a better understanding of why these are issues, and then hopefully we can move forward to find solutions. Thank you for listening to our snapshot of the findings from the adult survey. I'd like you to encourage you to look at the full report, and I will now hand back to Jana.
Thank you so much, Sophie, Laura, Charlotte, and Martin. That was it was kind of a whistle-stop tour of the many different insights from the survey. And if you are interested in the nitty-gritty detail, then please do follow the link that was posted in the chat to find out more. If you've got any questions or comments, also feel free to post those in the chat and we will pick them up in the Q&A. I will now hand over to my colleague Yumi from the UK CF Registry team, who is a medical statistician, and will be talking about some of the data in the registry. Over to you, Yumi.
Thanks, Jana. I'll just share my screen. Can you all see it okay?
Yes, looks great. Thank you.
Okay, great. Thank you. So yeah, hi everyone, I'm Yumi, and yeah, as I've mentioned, I'm one of the medical statisticians. So day to day, I work with the data that is on the registry, and that can include things like doing studies and doing the annual report. So this is the data from the annual report is what I'll be presenting and talking about today, and it will be the adult registry highlights. I'll just go over a bit of an introduction to the UK registry, and then present some of the highlight data that we've got on demographics, complications, health outcomes, and treatments. So for those of you that don't know about the UK CF Registry, it is a database that is managed by the Cystic Fibrosis Trust that stores the data from patients with CF who have consented to be on the registry. The data is made up from data that is routinely collected at NHS appointments. So that includes encounters and the annual review that patients have every year. The registry was founded in 1996, and the sponsorship moved to the Cystic Fibrosis Trust in 2007. And yeah, we collect a range of data, so that includes demographic, treatment and health outcomes data. And that's from 56 centres, 4 standalone clinics and 75 networked clinics across the UK. And just on the right here is a snippet from our highlights report this year. So it shows that 11,318 people were registered in 2023 on the registry. So that's anyone who has had an annual review in the past 3 years. And of those people, 10,344 people with CF had an annual review in 2023. So it's usually quite a high proportion of the registered people who come in for their annual review in any given year. So yeah, this presentation is focusing on the adult patient data, and what this is showing is the age distribution of that annual review data set that we have. So it shows that 60.5% of people with CF who had an annual review in 2023 had their annual review at an adult CF centre. So that's the yellow part of the donut chart here. And 39.5% had their annual review at a paediatric centre. So it's weighted towards people having their reviews at adult CF centres. And the box on the left here is saying in 2018, this figure was 5,670, and that's 57.6% of the annual review data set. So you can see it's gone up from 57.6% to 60.5%. And part of the reason behind that will be explained on the next slide. So what we're noticing over time is that the CF population is aging, and this graph demonstrates that. So generally, people are the overall population is moving into older age groups. So the light-colored bar charts here are showing the proportion of people in 2013 who are within a certain age group. And you can see that along the x-axis here. I'm not sure if people can see my mouse, but I'm trying to highlight the bits of the graph. So, for example, just over 6% of people with CF who had an annual review in 2013 were 2 to 3 year olds. And then the dark blue parts, dark blue bars are showing that proportion again, but in 2023, so they're a comparison of the two bars next to each other. So you can see here kind of overall, there were much larger proportions in 2013 of younger people, and that's shifting out now as people age into the older age groups. Over here, you can see there's increases in all of these age groups over the past decade. So that's what we tend to call moving into an aging population. Another bit of data that we present in the annual report is data on parenthood. So this graph is showing that figure over time. So you can see the yellow line here is showing the number of women with CF who had babies and reported that at their annual review. And the blue line at the bottom is showing men with CF who became fathers. So in 2023, that figure was 116 women and 31 men. So you can see in women, there has been quite a big increase since 2020. And just to point out here, we just actually present the current year figures in our annual report, but we can go back over time because we have annual reports going further back. So moving on from kind of demographic data towards health outcomes data, we also collect information on lung infections as like an important measure of lung health in people with CF. So overall, chronic lung infections are declining, and the graph on the right is trying to demonstrate this. So I'll kind of go over it a little bit. This is showing the proportion of patients who had chronic Pseudomonas aeruginosa infections registered at their annual review. And chronic Pseudomonas was previously a really common lung infection that patients would often get. So again, we're showing the age groups at the bottom, and the proportion of patients who had chronic Pseudomonas are then shown here on these lines. And each line represents a particular annual review year. So the very light blue line at the top here is showing 2017. And as the lines get darker, that's as the years progress. So you can see every year the proportion of people who have chronic Pseudomonas is actually decreasing. And the biggest decrease is generally between 2020 and 2021. And the yellow line at the very bottom is what we've reported for this year. So that's the proportion of patients in 2023. So this graph is kind of hopefully showing that there's been a year-on-year decrease almost in chronic lung infections. So I'll just show another graph demonstrating that. Another lung infection, which is Staphylococcus aureus. And again, you can kind of see the same pattern of the decreasing lung infections over time. However, this isn't for every type of lung infection. So another type is intermittent Pseudomonas aeruginosa. And this is where a patient has less than 3 positive samples recorded in their given year. And you can see here that very clear trend that was on previous graphs isn't as obvious. So yeah, there isn't the same decrease in every single type of lung infection. However, with less lung infections, generally which will damage the lungs, you can see in this graph that lung health overall is improving. So this is showing FEV, FEV percentage predicted for each age group in 2013, which is the grey line, 2018, which is the yellow line, and 2023, which is the dot line here. So between 2013 and 2018, they're kind of quite similar, but then there's this huge jump in 2023. So there's been an overall increase in FEV percentage predicted, which is a measure of lung health that we use in the registry. And in a related note, respiratory-related complications have also shown a decrease when we compare it over time. So there's been decreases in some of the complications that we report, for example, asthma, ABPA, and hemoptysis. However, again, so generally we're seeing decreases in respiratory-related complications. However, there are certain types of complications where we're actually seeing increases over time, or at least between 2018 and 2023. So for example, in liver disease, raised liver enzymes, gastroesophageal reflux disease, and distal intestinal obstruction syndrome. Sorry, that's some long medical words. We're seeing, increases. And this is a reflection of the earlier graphs that I showed. So as the population moves towards an aging population, there'll be changing challenges in managing CF health that will be coming up. And just to kind of show you a few more different types of complications that we have recorded on the registry. Some of these complications haven't changed over time. So for example, CF diabetes in 2018 was 33.8%, and 33.8% of people with an annual review. And in 2023, it was 33.7%. So there's been very little change over time. And some other examples are osteopenia and also depression, which for 2023 was 6.9% of the CF patients who had an annual review. Okay, and the final bit I'll go over is just to show you some of the data we have about treatments. So one of the common ones is intravenous antibiotics, which patients receive through the veins. And this graph is showing the proportion of adults, so over 18s, who are receiving IV treatment. And overall, you can see, again, that the trend is downwards. So from 2018, the proportion of patients receiving both hospital IVs, which is the top line here, and home IVs, which is the bottom line, is decreasing. And I'll just kind of highlight the middle bit of the graph here where there's this really steep decline. And that can be for a number of reasons. So it could be the introduction of modulators. It could also be the time that the COVID pandemic happened, where people were isolating. But the biggest drop is between 2020 and 2021. And yeah, I'll just kind of point out. So for example, in 2023, the proportion of patients receiving home IVs was 9.6%. If we go back to 2018, just 5 years ago, that was over 30%. And finally, I will kind of show this is every year we kind of review what data we're presenting in the annual report, if it's appropriate, if there's new data that we feel should be presented. So this is one of the new graphs that one of the statisticians has produced and is in our new annual report for the first time this year. And that is modulator use in people aged over 6 years. So it's showing the proportion of people whose last modulator that they used at the end of 2023. So 80 point, for example, this big part of the donut chart here, 80.2% of people had their last modulator recorded as elexacaftor, tezacaftor, ivacaftor, or Kaftrio. And finally, yeah, I'll highlight that the bottom one here, which is 13.5% of people, is showing that actually this proportion of people had no record of any modulator use on the registry. So I think that's all the data I had to present today, so I'll stop sharing my screen. Thank you.
Lovely.
Back to you, Jana.
Lovely. Thank you very much. Thank you very much, Yumi. I'm now going to ask, I think everyone is already on camera. So I'm going to ask my colleague Nicola to hopefully spotlight all of us so we appear for everyone. And I just want to kind of start off by thanking all our speakers. That was really interesting. And there's a lot of data. So I will forgive everyone if they're feeling a bit overwhelmed with all this information that's just been given to us. But if you are interested, there's lots more data also in the annual report that Yumi mentioned that has just been published from our UK CF Registry, and that's now available online as well, including an at-a-glance one-page document as well, if you'd like to have something slightly easier to digest. Right, we are now ready for questions. I don't think there have been any questions in the chat unless I'm mistaken, but we have had a couple of questions pre-submitted to us. And I'm actually going to start with, I think, a question for our 3 working group and involvement network members before going to my colleagues. So it would be lovely just to hear from the 3 of you how you felt your involvement kind of in the project made a difference. I can pick on someone, or if anyone would like to go first, please do feel free to unmute.
I'll go first. I kind of found I like to know things before people anyway, but I actually found that this because CF has become quite an isolating illness, and you don't see things. Actually, looking at these statistics, it's in a way quite comforting that you can see. You may be able to answer your own questions if you've got a question about annual review, like I have, which was about the exercise. Do people still do the exercise shuttle test? Because you're trapped in a room and you don't see much outside the room in hospitals anymore, it's quite nice to look at these figures, and actually you do get a good sense of what else is happening in the world of CF if you don't sort of experience those things. So for me, it was that learning I took away from this. But yeah, my main was I like to know things before other people. So yeah, it was really good to see these figures.
Fantastic. Thanks, Martin.
Yep, I would agree with Martin. I also like that. I like to see as well in, for instance, obviously Martin and I are kind of aware what our clinics maybe do. It's good to see what other clinics do as well. And obviously we know what's kind of coming out. So if there's changes in our clinics, then we kind of have a bit of an idea what they may be. I agree as well. It's quite isolating when, we only have online forums that we can kind of use, which are great, but that face-to-face contact we don't get to have. So knowing that there are other people out there that are feeling the same or kind of going through that is comforting. It's also really good, I think. I don't know if people appreciate how much involvement the CF Trust actually has for people with CF and really helping us to understand, we know what drives you and you're always, striving for change and trying to improve things. But I don't think when you go to a clinic, you really understand what the CF Trust does. You're just there for clinic, you have your appointments and then you just go. You may get an email, you may see something kind of on a social media page, but not understanding, well, what happens if I fill that in? I just can't be bothered. I want to go home. It's been a long day. But knowing that actually it is being looked at, recommendations are being made, people will try and act on it, is really quite great, and it's been a privilege to be part of. So yeah, that's
Thanks for sharing, Charlotte. That's lovely. And last but not least, Laura.
I just want to completely echo what Charlotte and Martin have both said. I think the things for me is that it's a really positive thing to be able to see the data and how well CF care across the board is doing, even though there's always improvements for everything. But I think it's brought, for me anyway, a sense of community, that there's other people that have the same feelings as you, but also same positive experience, sometimes same negative experience. But it's just knowing that everyone is all together in it. It's really felt like a community effort. And I think that really shows with how, especially how you've all spoken about it, how Charlotte and Martin have presented it as well, just shows that how everyone is involved and wants the improvement, wants to keep on the positivity and everything like that. So it's been a really good eye-opening experience. And like Charlotte said, Martin, really privileged to be a part of this.
Oh, thank you. It was wonderful working with you all, and I think it really helps us to generate meaningful recommendations from the tons of data that we get back. So I can only say thank you back. It was a pleasure to work with you, and of course you are involved across a number of projects with the trust, so we won't be saying goodbye to you in any way, shape, or form. One of the other questions that came through in advance, I'm going to go to Yumi or another one of my colleagues from the registry, was around any statistics, what statistics the registry has around pregnancy or breastfeeding, and what's being collected there.
Yeah, so I mean, obviously I presented one slide on kind of showing the number of births. In terms of pregnancy data, we don't collect a huge amount. So what we do have is if someone has given birth and the outcome of that birth. And in terms of breastfeeding data, we don't collect that data, so that's not something that we hold. I don't know if Susan wanted to add anything.
She's very welcome too. Could you just introduce yourself as well if you are? Susan. Thank you.
Thanks, Yana. Yeah, I'm Susan. I'm the senior statistician in the registry team. Yeah, Yumi's answered that perfectly. It's fine. We only really have a very basic information about pregnancy, whether, as Yumi said. But there are other aspects of some of the research work that's going on that's funded by the trust that might answer some of those questions in the future and might help answer a lot more about pregnancy and what happens to women if they're pregnant and have CF. So I suppose that's probably more of a watch this space, really. And we are hoping to be involving the registry in part of that research as well.
Yeah, brilliant. And there is a lot going on. So we've the representatives you have seen speaking today are from the quality improvement and registry team, and we have a lot of other initiatives and departments within the trust working on other projects. But I just briefly want to, before we go to some of the other questions that we've had, because they might take us slightly out of this this area. I just wanted to again point out some of the data that Yumi shared and how kind of positive a lot of it is, but I think also there's a clear message there of some of those complications that the work isn't done. And that's certainly what we get from our patient experience survey as well. And like Sophie said, we do act on everything that we kind of see and hear. Sometimes it might take a little while to get a project off the ground and find the information that we need. But we're working really hard on that. And you can rest assured that we'll try and feed back in events like this in the future as well. Oh, someone just put a question in the chat, which is great, and I might go back to Susan and Yumi for that one briefly. Is there any data yet on menopause and women becoming older with CF? Is there anything that's been captured around that?
I'm afraid not at the moment. No. As Lucy's just pointed out, the Strategic Research Centre matriarch will be looking at health and pregnancy and babies. I don't think we've got anything else in the pipeline at the moment to look at what happens in older age for women. Yeah.
I've certainly, though, heard that as a request for an event that my team might be hosting, where we facilitate CF professionals talking to each other about kind of best practices, innovations they're using in their service, and menopause is on the list as a topic for that event. So we'll try and at least enable sharing of what teams are doing while the research is going on, because I know there are various studies that are kicking off. There's a UK bumped study and international work as well with the European Society. Great. We had a couple of other questions that I'm just going to briefly and hopefully call upon a colleague who's on the call from our Director of Research, Lucy Allen, because we had two questions. One was around what we are doing for people who cannot benefit from Cuff Trio at the moment, and the other one was around any news around gene editing research. And of course, the quality improvement and registry team are not the best placed. So I'm going to hand over to Lucy to address those questions.
Thanks, Jana. Yeah, so there is lots of research going on at the moment looking at how we can support those that can't access and can't benefit from modulators. We recognise that was one of the top priorities from the research priority refresh exercise recently. So there's research that we're supporting at the clinical trial stage. So obviously the genetic therapy studies looking at alternative modulators as well. And there's lots and lots of research that we're funding through our Strategic Research Centre and Development Award schemes as well, all of which are focused, well, majority of which are focused on looking at either how we can research that addresses those that can't benefit from modulators, but also some of the more symptomatic issues that are associated with cystic fibrosis, such as diabetes, infection, cancer risk, etc. So yeah, there's lots and lots of research, and I can put some more links in the chat as well to give you some direction for some reading as well.
Fantastic. Yes, thank you, Lucy. That's great. And then the very last question leads us into the end of this session. I am probably going to draw it to a close here. We have a few more things that we kind of wanted to finish today. If there's any last questions, I'm very happy to pick them up in the chat. But firstly, again, a really, really big thank you to our speakers and our panel and anyone who's taken questions from the Cystic Fibrosis Trust. And of course to you all for joining us this evening. We're always really keen to hear back from you. So my colleague Nicola will be posting a feedback survey as well as a number of other links in the chat. And we're really thankful to any feedback you give us. We do base these events on the feedback you give us, and we can only improve if you tell us what we can improve on. Lorraine, would you mind sharing just a couple of the final slides with us, please? So we've got a few things while I address the final question that was pre-submitted to us. So it's relevant to this slide. The final question that was pre-submitted was, how can the CF Trust help people with CF navigate the current difficulties in the job market? And I just want to flag in a broader way our Work Forwards programme, which is a dedicated programme all about empowering people with CF to fulfil their career dreams and navigate the job market. They are available for one-to-one support as well as group sessions. And you can, and they're also involved with this wonderful webinar, which is also relevant, of course, to work and planning for the future, which is all about pensions and people with CF and the impact of Kaftrio and planning for a longer life. So that is at the end of November. You can join that. And if you'd like to make use of the other offers linked to our Work Forwards programme, that link will be posted in the chat for you as well. And as I said, they've got one-to-one sessions as well as group sessions, so they can fit really around anyone's needs. And if you've got specific questions, they can help you with that in terms of your career and navigating the job market and writing your CV and all of that. The next slide, please, Loren. So we also wanted to flag another event that we've got coming up, which is actually next week. So you might not know, but it is the Cystic Fibrosis Trust 60th anniversary this year. And as part of our celebration, we would like to celebrate some of the people in our community who've made a real difference over the years. And there'll be an online event for that next Thursday, where those awards are given out, and it should be a really special evening. So if you are free and you'd like to join, please join us for that. And the link is in the chat as well as on the slide right now. And then finally, we do love working with our community. So Laura, Charlotte and Martin are only three out of a lovely large group of people with CF, parents, family members who feed into a variety of our projects. And so if you scan the QR code currently on the screen or email us at involvement@cysticfibrosis.org.uk, you can get as involved as you like. You can stay informed about all the involvement opportunities, and you can pick and choose which ones sound most interesting to you. So if you heard what you liked what you heard tonight, do consider getting in touch and finding out more about how you can kind of support us to make sure that what we do is really informed by you and your experiences. Lovely. Well, thank you all very much. I don't think there was anything else in the chat, so I will bring it to a close here and hope you all have a lovely evening. Thank you again to our speakers and our organisers.